I am one of 3 siblings, proud parent of 4 adult children, and a caregiver to my mom and my youngest brother, who is developmentally disabled. Ariel requires a lot of help, assistance, support. He's nonverbal. He has a seizure disorder. He can't give us any indication that he's not well or that something is about to happen. Although he is on medication, there's always those breakthrough seizures. I was driving, and Ariel's sitting in the back. His seizures are severe. They're grand mal seizures, where he shakes violently, he foams, and he pretty much loses control of his body. Fortunately enough, we were about a mile away from Peconic Bay Medical Center, which I'm very familiar with. 911, the ambulance, the medics, they get there very quickly. And they asked a lot of questions that unfortunately Ariel could not answer on his own because of him being nonverbal.
You could see how much she loved him right off the bat. Like, she cared so much for him. And that was one of the first things that she conveyed to you, is how much she cared. That like spills over, you know, that changes how you approach that patient.
He came in and he addressed Ariel. In all those years that I had been in all those emergency rooms, had a doctor ever spoken to him and given him the respect that he deserved as the patient?
The respect aspect of the care that we give our patients and how we treat our patients and the caregivers is so important, because it shows that you're treating them as human beings. It shows that the family members that you're treating them as human beings. It's hard to understand somebody's situation if you haven't been there personally, but we're trying to do that. We're doing everything we can to express to them that we want to do that.
The Caregiver Center has been very helpful for so many families. That family member, that caregiver, they need to know that someone's there for them also.
The caregiver is just as involved in this interaction as the patient themselves. They're the ones who are there in the trenches. They're there every day, all day, taking care of all the needs of the patient.
So when I come in and I tell them, I know what you're going through. I've had those same feelings. I know you want for life to be perfect and for you not to deal with this. But tomorrow's a brand new day, and we're gonna be strong, and we're gonna keep going. And we're gonna push, and we're gonna give them the best life that they can have under the circumstances. And they are happy with that, because someone took the time out to let them know that it's going to be okay. One way or another, it's going to be okay. And that we're doing the best possible. And that's all we can do.